pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello, and welcome to another episode of Capitol Report. Today I have three guests, all of whom work at the community health centers in Dallas and who are traveling in Washington this week. Joyce Tapley, the CEO of Martin Luther King Jr. Family Clinic, joins me today, as well as two women from a well-known community health center, Los Barrios Unidos Community Clinic in West Dallas. And I might add that both of these clinics are in my district. And she is Director of Development, which is a very important job these days, raising money, that means. And the marketing is Joleen Bagwell. And so today we're going to discuss the value and the use of our community health clinics. We think that it's great work, and these women do tremendous work and have tremendous responsibility. I know because I have visited these clinics, and there are young people, even very small young people there with parents to get primary care. And I think it's a wonderful way to do it because they're out in the community where they don't have to travel all the way across town to another larger facility. So we're delighted to have these facilities. And I want to know now, what brings you here? Is this like going to the bank to hold it up? That's where the money is or something? Are you having a conference?
We are actually here for the National Association of Community Health Centers annual conference, Policy and Issues Conference, and we're also here to visit our elected officials. We're very happy to be here from Dallas, Texas.
Well, thank you. This is a very interesting time because we're dealing with the budget with not many figures on it, but a lot of principles. And I hope they'll give us some figures before they ask us to vote, but we never know. But community health centers are really highlighted in this budget because we're trying very hard to make health care available and accessible to all the people. And this is one way that it can be. And we have a number of community health centers and might be getting more because of the population growth and where it is and where they can get to it. And how do they differ from a private clinic?
Community health centers principally are different from other healthcare practices because they are community governed. What that means is our patients serve on our board of directors. They dictate the type of care that we will offer. That makes us very different from even other nonprofits. We practice evidence-based medicine, and we have employees that commit to work for us for many, many years, decades in some cases, to provide quality care to our patients.
And another thing that community health centers do that's different from private practice is that we try to operate and provide services focusing primarily on uninsured patients. We take Medicare and Medicaid, but we also try to design ourselves and set ourselves up to be a one-stop shop so that a person can come in and they can receive services medically and for dental services all in one location.
Mm-hmm. I have seen whole families come.
Yes. Mm-hmm.
And so it makes it easier for working parents to come in, get it done, and leave together.
Yes, our youngest patient is 1 week old, and our oldest patient is 107. So we see
that's quite a spread.
It is definitely, and they come back because they know that they get good quality care, and again they can see the medical person and the dental person all in one place, and also receive pharmacy services. So we do everything.
And most of these people do not have insurance.
Most of them do not have insurance, and because we receive partial funds from the federal government, that allows us to discount our services based on their income and family size. And so it makes it a lot more convenient for them. Again, they get good quality care, they get good professional care, and they also hopefully leave getting well, because we have been able to diagnose people with cancers, with different types of sexually transmitted diseases. We've been able to actually in our center, we've identified young kids very early on with some type of congenital disease, and we've been able to treat them or refer them out to a specialist and follow up with them. So they get a lot of services, and they leave happy, and they tell others, and they come back. And that's one of the main
Congresswoman
things.
Johnson, you remarked, having been to our building at Los Barrios Unidos Community Clinic, that we are in one of Dallas's most impoverished areas in West Dallas, and our clinic is big, and it's beautiful, and it's clean. 80% of our patients are uninsured, and we provide care, and the care we provide is excellent and top-notch. So community health centers have learned how to provide care to anybody, regardless of their ability to pay, without stinting whatsoever on the quality of service, but doing it in one of the most effective ways possible. So I'm really proud to be working for a community health center. I'm proud that you support the concept of community health centers as well, and want to take this opportunity also to thank you for the support of the ability through some funding, the stimulus funds, to be able to open a new community health center in Grand Prairie, Texas, because of your support. We receive funds, and it says, U.S. Congresswoman Eddie Bernice Johnson, in appreciation of your outstanding commitment and ongoing support of community health centers for Los Barrios
thank you very
Unidos
much.
Community Clinic. So thank you so much for your support. And
All these young faces on here, I could hug every one of them.
yes, we would love you to come hug every one of them. So it is a way to provide care for those who otherwise would not be able to afford care, but as I said before, not stint at all in the quality of care, and do so in an affordable manner.
Well, you know, Texas has the largest number of working people that do not have insurance.
Yes.
And so people that don't have insurance really would appreciate having this access to health care. And if they had access, they wouldn't be able to afford it
Exactly.
Right. Right. We make it
because of what
affordable.
they're making.
We keep our costs low with how we deliver the care. We also, in the state of Texas, have over 50 community health centers, federally qualified health centers, and so we are expanding as much as we can. It is definitely helpful to have the stimulus money as well as any other kind of support we can have from the president. And we want to be around for a long time. I've been at Martin Luther King Family Clinic for 10 years, and I've seen growth in a lot of areas, but I've also seen a lot of growth in the uninsured. And so we expand our hours and have late hours. We try to stay open on weekends. We do whatever we can so that we can make it convenient for our community so that they're not having to go to the emergency room unnecessarily.
Well, that's great. When I visited, and we've had our First Ladies visit the Martin Luther King Center, but when I was there with one of them, the younger people were teaching older I think they were from Germany, Jewish women and men, English, and they were learning from them, and they were like the grandparent figure, which I thought was a great program.
Yes, yeah. We try to do anything that we can to communicate with other folks from other countries. We have quite a few Spanish-speaking employees, so we try to do whatever we can to employ the right types of staff members so that they can communicate and relate to the patients that we serve. We try to reflect the patients we serve. And we see folks who are from the immediate community, South Dallas community, plus folks from other countries. So we try to
What
make
is
those
your
services.
diversity there?
We have primarily 60% or 69, actually 69 because it's grown. 69% of our patients are insured. 60% are black and 35% are Hispanic. And we have about much of a ratio with our staff members as well.
Now, you have probably somewhat of the opposite. You have
Very similar, very high uninsured. We've got 80% uninsured, and